Did you know that doctors could be fellowship trained in sexual medicine? It's true. There is fellowship designation that you can take to get trained in sexual medicine. And me and my very good friend here, Dr. Ashley Winter, both did that fellowship. So, for anybody watching, I'm Dr. Rachel Rubin. I am a urologist, fellowship trained in sexual medicine in the Washington, D.C. area. And I started a practice about 2.5 years ago. And I am so thrilled to announce that Dr. Ashley Winter, my co-fellow, has joined me and is now seeing patients in Los Angeles, California. And so I want you to meet her. Everybody welcome Dr. Winter. Dr. Winter, why don't you tell us about you?
Hi. Yeah, great to be here, and I'm so excited to join the practice. About myself, yeah, I'm a urologist. I'm originally from the New York area. Went out to California for our fellowship and never left the West Coast because it's great.
Well, I
Except
disagree.
for
You have
earthquakes.
you have earthquakes in the West Coast. And so
Yeah.
I'm so thrilled that you're going to be seeing what kinds of things, what does a sexual medicine doctor do, and what kinds of patients are you going to be taking care of?
Yes. Well, first and foremost, sexual health is health. So we do healthcare and we transform lives and relationships. And the sort of things we take care of are hormones, right? So menopause, perimenopause, but also testosterone in men and women, testosterone for everyone. It's so important. We look at sexual pain, so pain with penetration, pain with orgasm, pain after orgasm, pain in your penis, pain in your clitoris, low sexual desire, right? Like you, in theory, want to have sex, but you don't want sex and you want to feel like you want it again. That's like a crazy way of explaining it, but like that is something that we have a lot of tools for. Um, Not able to orgasm too quickly. Yeah, I could go on and on.
And that's and you cannot do this work in 10 minutes. And so, Dr. Winter, before you joined the practice, you worked at a health system in Portland that really you didn't get a lot of time with people. And what were your frustrations when you were in that kind of model?
Yeah, it's just so difficult because people would jump through the system and see doctor after doctor after doctor after doctor who would either, not out of any bad place, but not acknowledge a patient's concerns or not normalize the concerns or not be able to provide any tools for the concerns or try to explain away the concerns. And again, I I don't think it's because the doctors didn't want to help, it's because they didn't have the tools to help. And it was very hard for people to get connected to me because we didn't have the pathways to to make referrals for sexual health care concerns because it's just not acknowledged by large health systems in the way that it should be. And it was funny, I'd start to do certain procedures, right? Like you and I talk about something that's big in the care of our patients can be a lysis of adhesions for the clitoris, right? So when like the foreskin of the clitoris is stuck, um, and you can't feel the clitoris the way you should, you can't have the orgasm you should, you have pain that you shouldn't have, and this was a procedure that one time I wanted to do in the OR, right? Because I had a patient who was very sensitive and wanted some anesthesia for that. And everybody's like brain was exploding. They're like, we don't know how to make a tray for this. We don't know how to have a billing code for this. Like, we don't know if this is for urology to do. We don't like nobody does any procedure on the clitoris in our whole organization. And we care for 500,000 people exclusively. And it was just kind of wild. It was just kind of wild. And yeah, and part of the reason I left that and joined you was because I realized that the person who, let's say, had the problem with their clitoris was one of the most neglected people in that healthcare system, right? There was no place for them. Like if you have, you know, acid reflux, there was a place for you. If you have a prostate cancer, there's a place for you. If you have a kidney stone, there's a place for you. And if you felt like you didn't want to have sex and it was destroying your relationship, there was no place for you,
Okay.
right? So like
I love that. And so, right, we created our model as a way where we can spend time with people. And so how has it been seeing patients now in LA? And now you get the difference about spending 2 hours. What is it like to spend 2 hours with somebody?
It's so amazing. I mean, half the patients I have spoken to, I think teared up, and not because like I was saying mean things to them because I'm nice, but because like when you talk about something that's so deep in your emotions and your soul and it's been bugging you for so long, and you have a healthcare provider and you actually like they just sit there and they listen to you about this thing, you get emotional, right? And it was nothing I did other than having the time to sit there and hear what was at the bottom of their soul with their sexual healthcare concerns. And it's just incredible because you just say, this is the reason I wanted to become a doctor, was to have like my patients open up about these things, and I wanted to hear them and give them all the tools I could to fix it. But first and foremost, to hear them and see them in a way that they had never been heard or seen before. So that was the first thing. The second thing, having feedback like, oh, nobody's asked me that before, ever. Like nobody's ever asked me that before. And that's come up multiple times, and being like, yeah, well, I actually have the time to ask you like everything, like get to know you, but also ask you questions that put together pieces of the story, right? So like an example is, sometimes when people have pain with sex, we ask them if they have a sensitive belly button. And that sounds crazy, but it's because, right, your belly button is attached to this part of your body called the vulvar vestibule, right around the opening of your your vagina, and it's attached to your bladder, and this is all part of something called the urogenital sinus, and it's super important. And I explained to them this like embryology, and I'm like, this is why if you have a sensitive belly button, you could also have pain with sex. And they're like, like mind blown, like the little emoji, like steam coming out of the ears. And even if that doesn't end up being their problem, it's just like they learned something and somebody tried to put together that piece for them, right? Or asking somebody who has sexual pain about hypermobility. Nobody's asked me that before, right? Like just feeling like somebody's investigating your problem, trying to get to the bottom of it, being like the Sherlock Holmes of your body.
I do think our future podcast will be, sex detectives, and that we can really
Yes.
go deep into these complex issues. And I think it's really important to spend time with people, because sexual health is not one part of the body. It is not just the clitoris. It is not just the brain. It is the whole person. And it's the whole person in the context of their life and their relationships and how they see the world. And if we don't dive deep and get to know that, we can't fully help. And we see magic on the other side. And the problem is most people have never invested in themselves to spend that time digging deep into those issues, to expanding their knowledge so that they understand their bodies fully. And so that's why we're so thrilled to have you in LA, so that you can help patients on the West Coast while we help patients on the East Coast. And what we're doing is we're investing in really brilliant people who use their brains and can really not only know the science, but expand the science, who are constantly thinking of how we can do this differently, better, and really give good results for our patients. And that's what we see every day, is these amazing relationships saved, lives saved, really quality of life improved drastically. So I'm so thrilled. Dr. Winter, anything else you want to tell people about coming to see you in California?
Well, I will say, like, the most recent patient I saw on the way out, what she said to me was, for the first time in a long time, I have hope. And it wasn't because like I told her any nonsense, or like, I just gave her information and showed her her own body and gave her a plan based on her body and information. And she said, for the first time in a long time, I have hope. And like, that is what I want. I want everybody to walk out of the office feeling like that, So that's what we're doing. Yeah, come see me. Our office is located in Pasadena. But I also do telehealth. So if you're anyone from California, I'm happy to start with a telehealth visit. We can also do follow-up that way, which makes things super convenient. We have an awesome team. We are here for you.
We are super excited. So you can call us. We'll put the number down below. You can email us at office@rachelrubinmd.com, but we'll put the information down below. And just, we're so thrilled to have Dr. Winter join the practice. And all questions, put them in the comments and we'll answer.
Yay.
Bye.
Bye.
Let me